Good evening, ladies and gentlemen. Thank you so much for the amazing invitation, and I'm truly honored to be part of the national team of Greece for medical tourism. I will speak from the perspective of somebody who's been practicing in Greece and in the UK for the last 28 years, and I will try to highlight the reasons why Greece has become a world-class destination, and it is our duty to sustain that. And part of our duty is to promote partnership. We're not here to take clients away from local clinics, away from local doctors. We're here to work alongside our partners, our partner clinics, our partner physicians, practitioners, and I would like to thank all of my associates and colleagues who've accepted the invitation and are in the audience. So we're here to break the barriers of fertility patients all over the world. Today, within the Europe that's supposed to be united, there's a lot of barriers. There's a lot of diversion as to what is possible and where, as to what is feasible and where, and what is legal and what is not legal. And it is our duty to educate and to work together as a team for the benefit of our patients. We're here to promote the relationship between Greece and England, but also to promote the option for our patients, and the option includes the ability to have the desired outcome, which is a healthy child. All started in Greece about 2,500 years ago. Many of the previous speakers mentioned Hippocrates. Everybody knows Hippocrates. Very few people perhaps know this little spot, this little dot on the map, which is the first sanctuary in the world. It's called Epidavria, and this is where the ancient healer Asclepius was actually practicing. Even less people know that this chap over here didn't just practice medicine, he practiced holistic medicine. And this is one of the messages I would like to bring across today, that we're not here as the healers of the body, we're also as healers of the mind and the soul. And we're just following the steps of Asclepius. So as you can see, he also built a theater which is functional today, because he was actually looking into the holistic aspect of treatment, which is something modern medicine has failed to look at. And of course, Hygeia, his daughter, this beautiful face, this beautiful statue, and of course, she has given the term Hygeia, hygienic, which is healthy, to the world. It took about 100 years for Hippocrates to come into vogue, and of course, he followed the same model. He built same model sanctuaries and hospitals, and also looked after the soul as well as the body. And of course, his hospital looked a bit like this in Kos. We're talking 2,500 years ago, and I'm sure that many modern facilities would envy that. So why abroad? This has been covered. Fertility patients have to travel. They're obliged to travel to find a solution, and this is becoming a global problem. This is definitely a problem of Europe, definitely a problem of North America, definitely a problem of the Western world, where the fertility rates are dropping massively. If we can quote some figures, the fertility figure required to sustain a population is 2.1. Does any of the advanced countries in Europe achieve that figure? Negative. What's the average European fertility rate? 2.7, even taking into account the immigrants, who the influx, and they try to kind of sort out this fertility rate. England fertility rate 1.7, the UK 1.7. Scandinavian countries, we've been brought up in Greece talking about the Scandinavian paradise model, 1.8. Greece, 1.3. So this is a global problem. This is a global demographics problem that has to be addressed. And of course, this has been all studied and scientifically proven. The first article that appeared in good press, good scientific press, was only in 2011. So cross-border, and that is an article of 15, I can see Professor Harper nodding. This article only contained 15 patients, for God's sake. That was 7 years ago in the highest ranked scientific journal. So that was addressed by the UK scientists. It is a problem, it has been addressed, and of course the reasons why people travel is now widely known. So why Greece? It is known that it's scientifically and technologically advanced. There are regulated and quality assured clinics. The legal framework, I would say that it is liberal. So there's altruistic surrogacy, as Dr. Gynaecologist mentioned. There's altruistic egg donation and not commercial. I repeat, altruistic. Some people ask me, why do people donate eggs? And I turn back the question and say, why do people donate blood? It's the same donation and altruistic motive, and of course people do as much as they could. There is safety and success. Now there's European standardization of procedures, and there's European registry of success rates and complication rates. So at least Europe in that sense made something good. And there's no waiting list. You ring up a clinic today, you have a Skype tomorrow, you can be treated before Christmas. This is totally unheard of for UK standards and for Central Europe standards. The cost is affordable. This is important when we're talking about treatments that are not 100% successful. So if you, on average, if you need to do 2 or 3 treatments, then with the cost of paying one, perhaps in the UK or in North Europe, you can have the full package in Greece. Now, reputation, this is a very heavy word. Reputation has been built about 20 or 30 years ago by the previous generation to mine, by people that Professor Harper mentioned who worked together with her, by some famous scientists that produced some very heavy research. 30 years ago, Professor in Hammersmith, there was full of Greek doctors. There was about 20 fellows of the Royal College who, funnily enough, they all did fertility, and most of them are practicing in Greece at the moment. So reputation is built by science, it's built by work, it's built by being ambassadors of good service, it's built by patients who speak to other patients about the experience they gained in Greece. So these are the reasons why Greece. And in terms of numbers, there is an estimate that 5,000 fertility patients are being treated every year in the last couple of years in Greece, and this is the evidence from the Hellenic Association of Fertility Specialists. That's a lot of patients because they require at least 2 visits, and they stay for an average of 10 days each time. So that's a lot of patients and a lot of feedback that we're getting. Our clinic is EmbryoClinic. We like to say that from cells we produce smiles. Our head embryologist is UK and very well known. Most of the junior kind of embryologists in the UK at the moment are his trainees, and we practice in EmbryoClinic in a beautiful city called Thessaloniki. We were established in 1999 with 30 members of staff. 4 of them have PhDs, which is very important, and 10 postgraduate degrees. And we've been treating patients from over 25 countries, and there's 6 nationalities within our clinic speaking fluently more than 8 languages. We are associated with the largest private hospitals of Europe at the moment, and definitely Greece. St. Luke's Hospital, where we're proudly directing the gynecology services, and the Inter-Balkan Center, where we treat complicated pregnancies, and also we perform robotic surgery. A little concept in the last 2 minutes that I have. This is the Alpha Zeta, A to Z, Alpha to Alpha Omega concept, which is the true holistic concept, which has been instituted about a year ago, and this is world's first. I have a video which I don't know how I'm going to play here. Any help, please? Yes. It's only 1 minute, and then I have 30 seconds to say goodbye. Can't hear? Okay, there's no sound. We can't see the video then. The Alpha Zeta concept is world's first, where we do like conferences for patients. We get patients, we get professionals all together under one roof in a beautiful place somewhere in Greece. We've done 2 of those over the last year. So we institute the importance of treating the mind and the soul, and not just the body. So we try to educate patients in terms of providing them the best optimized support in their journey. We've attracted patients from all over the world for this concept. This is a couple from the US.
Support you all the way.
We've got some sound now.
Personalized care with respect and honesty, consistency and communication, understanding and trust. The Alpha Zeta team invites you to a unique and truly holistic retreat of fertility care. a life-changing and life-creating experience.
So we're trying to mimic a little bit Asclepius. So thank you very much for listening. I'm still on time and see you in Greece. Elias Tsakos, γυναικολόγος, υπεύθυνος της κλινικής EmbryoClinic IVF στη Θεσσαλονίκη.
Θέλω να μου πείτε δύο λόγια για την προσπάθεια που γίνεται για την εκστρατεία για τον ιατρικό τουρισμό και για την ημερίδα τη χθεσινή που είχε πραγματικά κατά γενική ομολογία πολύ μεγάλη επιτυχία.
Είναι μια προσπάθεια η οποία προβάλλει την Ελλάδα σαν παγκόσμιο προορισμό ιατρικού τουρισμού, στην οποία προσπάθεια ενώνονται άνθρωποι οι οποίοι ασχολούνται με το αντικείμενο τόσο εκ μέρους της πολιτείας όσο και φορέων, τόσο της Ελλάδος αλλά και παγκόσμιοι. Στην Βρετανία έχει πολύ ιδιαίτερο ενδιαφέρον διότι υπάρχει τεράστια ομογένεια αφενός και αφετέρου η ελληνική παρουσία στη Βρετανία στον επιστημονικό τομέα είναι γνωστή και μεγάλη. Η ειδικότητά μου, η ειδικότητα της γυναικολογίας και πιο συγκεκριμένα της γονιμότητας αποτελεί κατά τη γνώμη την αιχμή του δώρατος του ιατρικού τουρισμού, διότι η Ελλάδα είναι ήδη ένας παγκόσμιος προορισμός γονιμότητας για ζευγάρια από όλο τον κόσμο. Η Βρετανία έχει ένα ιδιαίτερο ενδιαφέρον για μας, ιδιαίτερα για τη δική μας ομάδα που έχουμε εκπαιδευτεί και έχουμε όλες τις σχέσεις με την Μεγάλη Βρετανία, αλλά και γενικά για την Ελλάδα, διότι υπάρχουν σχέσεις και η γυτνίαση. Τα πλεονεκτήματα της Ελλάδας είναι μεγάλα για τον ιατρικό τουρισμό γονιμότητας και ανάμεσα σε αυτά περιλαμβάνεται πάνω απ' όλα η φήμη που έχουν οι Έλληνες γιατροί της αναπαραγωγής και αυτή η φήμη έχει δημιουργήσει ένα μεγάλο ρεύμα ασθενών από τη Βρετανία που έρχονται καθημερινά στις κλινικές της Ελλάδος. Τα αποτελέσματα είναι πάρα πολύ καλά, πάρα πολύ ψηλά, είναι δημοσιευμένα, υπάρχουν στην ευρωπαϊκή ιστοσελίδα των μονάδων αναπαραγωγής, αλλά κυρίως είναι η φήμη η οποία παράγεται από τα ίδια τα ζευγάρια τα οποία γυρίζουν στη χώρα τους με ένα παιδί. Αυτά είναι τα βασικά πλεονεκτήματα και επιπλέον αν σε αυτά κάποιος προσθέσει και το κόστος, το οποίο είναι κατά πολύ χαμηλότερο σχέση με τη Βρετανία, δημιουργεί την Ελλάδα σαν έναν γοητευτικό προορισμό γονιμότητας τόσο για τη Βρετανία όσο και για τον υπόλοιπο κόσμο.